Health agenda, Wednesday, February 17th, a Zoom virtual meeting. The town of Littleton began conducting remote participation Zoom meeting pursuant to the Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020, almost a year now. Since that time, unfortunately, unanticipated legal concerns related to the open meeting law have been brought to our attention by the town clerk. These concerns are supported by the Attorney General's office and confirmed by town council. The concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially a running commentary that is occurring but is not moderated and followed by the chair. All participants and listeners may not be aware of the comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated into the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meetings are set so their microphones are muted. If you call in by phone, please use *6 to mute or unmute your phone. So when the meeting can occur, so that the meeting can occur in an orderly fashion, we ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you call in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute and state their name and address, and after speaking, we request that the participant return their microphone back to mute. So we're just going to start with the continued hearing on 83 Mill Road. And you guys said that Ted Doucette's in the audience already. So if you can join, yep, thanks, Dave. From the kitchen.
From the kitchen in New Hampshire.
Oh.
I'm up at Attitash.
Don't rub it in.
Oh, it's, I don't know, it's that much greater up here.
The hearing doesn't count.
On the slopes.
The hearing doesn't count because he's in a foreign country for all intents and purposes.
You know, everybody.
All right, what you got for us, Ted?
So I've got a lake lot here. This is Mill Road. This is if you come in from Mill Road off of King Street by the church and you go all the way to the end, right before 495, there is a small house on the right, and it's a 2-bedroom house. If you can see the plan, actually, I don't even have the plan here. I don't have it ready to share because I am remote. I don't know if you've seen it. It's a you come down to the end of the cul-de-sac, and the house is on the right, and there's half of the yard slopes down towards the lake, and then there's a house kind of in the middle lot, and to the left there's a parking area and a driveway. We conducted about 7 test pits out there, 8 test pits, and we found only one place that's suitable for a septic system. I've sized the system there, and I've located there, and we can meet full compliance with 220 gallons per day design flow. We have a 5-foot groundwater offset for a 2-minute perk rate, and we do have a couple variances. The plan states that I request a variance from the 5-foot reduction in the 5-foot groundwater offset, but we don't need that anymore because we have found that testing does provide 5 feet. So we have a couple variances, and they're to allow the system to be within 10 feet of a property line, and to reduce the offset from a water supply line because we'll have to relocate that. This is really the only location to put the system, and it's right through the existing water line. We found ledge. If we tried to move it further away towards the highway, we found there was ledge there, and this is at the extreme limit of the property.
So the 10 feet of the property line, and what was the other variance?
Oh, from an offset from a water line, reduced from 10 feet to 5 feet, and the specifications require sleeving the water line.
All right, Jim, do you have anything to, I don't believe we've seen it. Ted, we've been short Janet,
Yeah, yeah.
so we haven't gotten a few things. So, Jim, do you have anything to say about?
Sure. So as Ted mentioned, it is a small lake lot. A number of challenges. The lake is right there, so trying to make sure you're staying that 50 foot off to meet the Title V requirements. Fortunately, the soil cooperates in the upper. I guess it depends on your perspective, but with the house to your back, the upper left-hand corner, there's decent soil. There is ledge all around it, so one of the reasons we have so many test holes is we had to kind of hunt and peck around to see what we could find. But that corner seems to provide enough soil and the water table is deep enough to put a system there. Unfortunately, to try to move the water line much more than Ted's suggesting may run into the ledge. And again, we're trying to keep the water line deep enough too so that it doesn't freeze during the winter time. I think it's a reasonable request given what you have to work with, the water lines, the wetlands, the water lines, and the small lot size.
So you don't have a problem with either of the variances?
I do not.
Okay. Anybody from the board have any questions?
No, it seems reasonable. You can only do so much, I guess, when you have a piece of property.
Kevin, Mike, Kevin?
I have just a question, if it's all right.
Go ahead.
Ted, I think you said this is a 2-bedroom. Okay. The reason I asked this question is I know some realtors are listing as a 3-bedroom for reasons which aren't clear, and now it's a 2-bedroom. So, I take it the capacity is the same, or shall we say, doesn't make any difference?
So I don't know all the laws about realty, but it's only a 2-bedroom design. So from what I understand, it is supposed to only be advertised and sold as a 2-bedroom.
Gotcha. Okay. I was just worried about the capacity of the system you're putting in. Okay. Thanks a lot.
You're welcome.
What type of system is it, Ted?
I'm sorry, type of system is stone and pipe. I don't do those very often, but it turns out that stone and pipe trenches are really space efficient, and that's what we're going here in order to achieve maximum feasible compliance. I figured getting capacity, I think, is the first thing that we go for. We try not to reduce. I try not to reduce capacity.
And you don't need an offset to the groundwater.
No, we found it. It was our 3rd day out there testing, and I just told the backhoe to go as deep as he could, and he got to, what do you get to, got to 12 feet. I couldn't believe it when I walked over the hole and saw you had that deep. So yeah.
And do we need to do a deed restriction for a 2-bedroom? Because you don't see too many 2-bedroom septics.
So
Right, you'll have to file a deed restriction.
Yeah, so that'll be a condition on the permit.
Any abutters? Did you notify abutters?
I believe I did for conservation. I'd have to go back through. Sorry.
Yeah, with the property line offset, that requires notifying the abutters 10 days.
Okay. We started I did file this a long time ago. I'll confirm it if you want to hold that for the permit, Jim, to get that notice or the certified mails.
If that's okay with the board.
That's fine.
I think
I'd
that's
like
fine.
to make a motion to approve, given the notice to the abutters.
I second it for the same reason.
Great. So we'll do a roll call. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Yes.
Mike Zeldin,
Mike Selden, yes.
and Lisa Flanagan, yes. Right. Thanks for having the patience and keep coming back, Paul.
Well,
Ed, sorry.
thanks for your patience for me. It was filed a long time ago, and then we had to keep going back and testing. So thanks a lot for that,
Yeah.
and keep up the hard work. Thanks so much.
Thanks, you too.
All right, bye.
Thanks. So that was the only public hearing that we had. Anybody have any, and we're just gonna, we didn't have the COVID update put actually into the agenda, so we're gonna have it in public comments. So Jim, can you hang around for a few minutes?
Absolutely.
Okay.
Yep.
Anybody have any correspondence that they want to talk about?
No?
No? Okay. Diane is going to get us the minutes for next week, for last week, so that we can approve them at our next meeting. Any member comments at all?
No?
Okay. I know that we listened. I don't know, Gino, you weren't here last week, but the schools have started doing the pool testing, but it's school vacation week, so we're
I
not
got
getting
it.
no information from them for this week. So,
I got it. Yep. Thank you.
any other member comments at all, Mike or Kevin? Guys, come on. Okay, we'll do the public comments. So, Jim, you have any updates for us?
Sure. So let me start with the COVID information. So again, today, the governor's press conference, he announced that those 65 and older and those with 2 comorbidities are eligible to receive vaccine starting tomorrow, which is all in all a good thing. We're actually expanding the eligibility. About 2 hours before that meeting, local health officials received a letter from the Secretary of Health and Human Services, kind of, framing the governor's new, well, I should say, framing the administration's vaccine distribution plan. And they kind of went through the status of the vaccination process at this point here. And then they go on to discuss the plan going forward. They're looking to kind of streamline the process. And so, Mike alluded to the fact that these high throughput sites, there is some benefit to them because you get lots and lots of people vaccinated very efficiently. And I think everybody, not only at the local level, but the state level, we're being asked to demonstrate that we're administering vaccine to be able to get more vaccine from the state. So I think, part of the reasoning for the state to do this is so they can show the federal government we're getting this vaccine out. Then they go on to talk about part of their plan, the equity part of their plan and trying to serve underserved areas. And so there are 20 communities in the state who will, some additional emphasis to make sure vaccine gets to those citizens that have had the greatest COVID burden. Littleton's not one of them. So I think the closest communities are Fitchburg and Leominster of the 20 communities. Actually, there's some Lowell's one of them too. So we're kind of in between those sites. Serving the most vulnerable, again, they're putting resources into making sure those areas that have been underserved get served. And then they talk about regional collaboration. So if municipalities or other entities wanted to get together to set up one of these larger sites, they gave you kind of a breakdown of what you'd need to be able to do to become a regional entity that's vaccinating in the state. Again, I think the push is to get more larger sites so that you can get through the vaccine quicker. So kind of the rundown of the requirements to be one of these regional sites, you have to be able to administer at least 750 doses a day, 5 days out of the week. You have to, kind of serve an unmet geographic need as identified by the Department of Public Health. You need to meet the vaccine administration threshold of 85%. So 85% of the vaccine they give you, you need to be able to get rid of in that period of time that they're giving it to you. And then report all the vaccinations that you're given within 24 hours. That 24-hour part's not that hard because if you use the software, it's almost automatic once you're done the clinic. Serve all of the residents in the Commonwealth. So you can't really have, if we were to set up a regional site, it couldn't really just be for, say, the Neshoba district. It would need to be statewide. And then you need to have the site listed as a public vaccination site on the state's website. So all of those things make it very difficult for us to do a regional site. Today, we administered nearly 300 vaccines in about 5 hours. And it was pretty smooth. We probably could have done more just because they're younger folk and some of them come with just a t-shirt on. So, they're ready to go right away when you want to put the needle in their arm. Kind of compared to the 5 hours or 6 hours it takes to run through a couple of hundred persons who are 75 and older. So the last part of their letter essentially states that, starting March 1st, they're no longer going to be sending out first dose vaccines to the local clinics. So essentially, we can finish up the folks that we started, and then we won't receive any more vaccine because of this emphasis on these larger, more streamlined clinics. So it's important for you to know that. The Department of Public Health is going to kind of explain what the boards of health's role may be going forward on our meeting on the 9th. I'm sorry, the 19th. It's 19th of Friday, our typical Friday meeting. So it's a little disappointing because I know though our clinic at Devon's was small, we were doing a couple hundred people a day. We had hoped to kind of get that a little bigger, and that site had a very short distance from the parking lot to the front door, and it actually has an overhang over the front door. So if you really needed to, you could, and people did, drive people up to the front door and let them get out right in front of the clinic. But we'll do one more of those next Wednesday, and then we'll do 3 second dose clinics. And unless things change, that'll be the end of vaccine clinics for us. I don't know if you have any questions on that.
Well, that's too bad.
Yep.
The higher risk areas, do they need to show proof of residency in those higher risk groups to get a vaccine?
They didn't really go through the details of those. I was kind of curious on those. So there's 20 communities that they're targeting: Boston, Brockton, Chelsea, Everett, Fall River, Fitchburg, Framingham, Haverhill, Holyoke, Lawrence, Leominster, Lowell, Lynn, Malden, Methuen, New Bedford, Randolph, they have Revere, second time, Springfield, and Worcester. They don't go into saying if the sites that can be run by the municipalities there would be open to people beyond the community borders or just those communities.
And then I think we still have a waiting list on our town website with the Council on Aging. Is that something that we should probably have them take down, or?
So I was on a meeting with Anthony, Scott, Ashley, the town employees today about what to do about that. So I've drafted something based on this memo that they can put up on their sites that will also go out to the board of health chairmen, the town administrators, about this letter, where it kind of puts us clinic wise. And in there, it includes the link to the state website. And I don't know, I think it's a little easier if you click on that that mass.gov COVID vaccine. It first starts with your eligibility, which I think is important for everyone to know, because beforehand, people were calling and saying, "I want my shot," and then you talk to them, it's like, "Well, you're not eligible yet." So this site starts with eligibility, and then you scroll down a little bit, and then it allows you to kind of click into locations where appointments are available, and that site allows you to enter in like zip code and that, and find a site that may be close to you. And I'm listening to the news before I came back in. They said that there should be 70,000 appointments tomorrow available after 8 o'clock. So we'll see what happens. But that's going to be, and they have the disclaimer right on that site, because of tight supply and because of high demand, you may anticipate that it's a few weeks before you get an appointment. So none of that's good news, but that is kind of the state of where we're at.
Excuse me, Jimmy.
Yep.
In Littleton, we have more than, I say, 2,500, over 75. Is anywhere they can be taken care of it, and when it's going to be able to be taken care of for the first shot?
So we have vaccine. We have a couple hundred doses that we're going to administer at the clinic at Devon's on Wednesday. And that's all the vaccine we have. So that's kind of divvied up between all the communities. And that's not going to get anywhere near that 2,500 people that you're talking about. So those individuals are going to need to go through the state website to get an appointment, or through their doctors, or the federal government announced that they were going to send out, they were doubling essentially. So they're going to send out 2 million doses to pharmacies starting either this week or next. So that's another opportunity for people to check with their pharmacies. I know on the state site where you can locate a clinic, there are pharmacies located, but as of about 5 o'clock this evening, when I was just kind of rooting around there, a lot of those pharmacies didn't have appointments available. So
I agree with you.
You got to keep coming back and checking.
Yeah, I understand that. When I made the call for my sister on the CVS, they say everything is already taken. There's no appointment. You have to wait.
Yep.
But I was able to make sure that my sister got one.
Good. That's good to hear.
Yeah.
Jim, I just for a quick update from your perspective, are you getting any sense at all that the supply of vaccine for both shots, obviously, because if you schedule someone for shot 1, you automatically have to schedule them for shot 2. Otherwise, you're wasting shot 1.
Correct.
So, okay. So my question is, did you get any hints, even between the lines, or maybe explicit, about how is it they can't staff? Let's say you had a large site. Let's say for whatever reason we were able to put some sort of operation. I'll just make this up at IBM built, the whatever, something large where you can park and all the rest.
Sure.
Is the issue personnel and for if you want to set up some things that you need X number of personnel, do they have an understanding of how many people are needed to support a mass vaccination site?
So today's site, again, we comfortably did 290 people. These are the first responders getting their second doses. And again, people who have no problem coming in the door, people who have no problem, taking off their whatever clothing they need to, putting it back on, like I say, often coming prepared just to get their shot. It's a pretty quick clinic. I mean, they can get through. We scheduled appointments every 3 minutes. Nobody waited in line at all today. That
Good.
clinic we were fortunate to have Littleton Volunteer Corps there to help us out, and the Boxborough Emergency Reserve Corps there to help us out. We had lots of, probably half of the vaccinating staff or more were volunteers. And so that clinic went quite smooth, and we probably could have done more there. But again, trying to staff that 5 days a week, 750 people a day, a clinic that was doing 750 shots a day might need 40 staff, if I had to guess, just kind of backing out of what we did and trying to expand it to what, just using our numbers and going out.
Yeah.
To have that every day of the week, that's a full-time job for the person planning it, let alone finding that staff every 5 days a week to be there doing that dosing.
And who pays the staff other than I assume the volunteers? Is the funding source coming for that?
So no. And then so I don't, so the funding for these clinics, the vaccine's free. So it's free to anybody who gets the vaccine.
Yeah, I got that. Yeah.
So, but individuals who vaccinate can bill for the administration of the vaccine. So you can actually get paid to put it in the arm. So part of that software, not only does it send the information to the state's database for vaccines, it also sends the information to the state's billing arm, which is Commonwealth Health, for billing purposes. So then you submit that information for billing, and then you wait to get billed. I don't know how these large sites are funded. Like the CIC Health, I don't know how they're funded, and the other entities who run large. We have been fortunate that we've had volunteers. We use some of our staff. Some of the staff, I think towns can use FEMA money to pay for vaccine staff. So you have to kind of cobble it together.
Yep. It takes a lot of support staff to do large volume. I mean, you're right. You could probably handle 750, but I'm not sure around here you'd be successful in getting all the staff you need at each station, and the shall we say. I just noticed at Gillette there seemed to be a support staff person, each with a slightly different function.
Right.
I would say about every 20 feet maximum. In other words,
and the same thing with our clinic. So we break it down. If you can chop the jobs up, smaller and smaller, all of a sudden you can train somebody really quick to do that particular job.
Yep.
So you have people in the parking lot bringing people forward. You have people just inside the door checking to see if people have symptoms, inside screening for the vaccine itself. Then you have people actually doing the vaccinating, and then an area for people to sit. So again, we've chunked it up enough that, particularly for these clinics, every 3 minutes, there's no waiting.
Yep.
Beautiful. Hey, Jimmy, you can always ask Rotary for some volunteers.
For who?
Rotary.
Oh, Rotary. Yep. And to Mike's point about, we could probably do a clinic at 750 people, but whether you have the ability to sustain doing it 5 days a week, that's a different kind of take. You really need to have a staff that's dedicated to doing that all the time.
That is true. But anyway, they asked me to tell you that.
I appreciate it. Yep. Like I said, the Reserve Corps have been wonderful. The volunteers from the communities have been wonderful. We've had nurses from Littleton and from Lancaster and from Ayr who have come to a lot of our clinics. and even a couple of other towns, named the towns escape me, that have come and showed up. I mean, some of them are on their fourth or fifth clinic with us. And they
Wow,
come, show up for the day and vaccinate all day long.
unbelievable.
It's, to me, it's one of those little bright spots in this whole pandemic, is that these people are willing to come out and vaccinate.
Jim, from a safety point of view, from a practical point of view, would it make any sense for the communities, the Neshoba area, to consider, I'll use the word, busing to the mass vaccination sites? In other words, doing a coordinated sign up and busing operation. Do you think that it would be money well spent? Let's put it that way.
Again, another coordinating piece of it. So I know some of our local council on agings have done just that. They have people making appointments at the Gillette site, and then they'll take their senior vans and drive them down. I assume drive them down to the clinic. So
I saw them on the I saw them on the road, just walking up the road there. I'm teasing it.
So I know at our clinic, we've had vans from probably 8 or 9 of our COAs that have brought people down.
Sure. Yeah.
And so depending on the town and the sensitivity of the folks in the town, we've had vans that'll bring 2 people on the van down. We had one town that brought 5 people on the van down.
Wow.
Yeah, we've got to think about social distancing.
That's right. So
Yeah, no, I know that's tough. It's tough. Okay, thanks.
Kevin, did you have anything that you wanted to ask?
Jim, I mean, given that Neshoba services 17 communities, I mean, is there an appetite there to try and set up a regional vaccination site?
I just don't know that, again, it would take a full-time staff
And
and
a
5
lot of
days a week, and somebody to set it up. And there was one of the chiefs was actually helping us, one of the fire chiefs from one of our towns was, and they had actually formed a small group of kind of a subgroup of towns and became a vaccine provider. I think Littleton has done the same thing, to try to maybe service town employees or certain groups. And, in talking with them, I think they felt the same, that the benefit that you might have if you could set it up, if you could keep it just to your towns, kind of is lost by having to open it up to the Commonwealth, and that effort of trying to staff it full time. That's a big task. I mean, I think you'd have to hire a contractor to come in and do that. I know with these small clinics, it takes up a significant portion of my time, just scheduling volunteers, making sure we're not over promising vaccines, kind of tracking people. So,
Hey, Jimmy, did you already find out a site for a bigger group, like for instance, 400 or 500 people?
So when we first went over to Fort Devens to approach them about doing a clinic there, I think one of the hotels had offered, and when we went into the hotel, it was bigger than we thought we needed for the number of doses we had. So we went over to the old Officers Club, which is perfect for what we're doing, and you could probably even ramp it up a little bit larger. So I think there may be a site over there, but again, it's one of those things where I think you need to find a partner that can work full time on this to do this for you.
I got it. Yeah. Before I forget, is there any way that the town would allow to use the school bus, even though they have to be away 3 feet for each other? Let's say, for instance, there's a 40 seats. They can put 20 people instead of put 2 people in the van, and they can go in and out until the kids come out of school, so they can use the bus from the town without having any expenses going away. Is there anything you can talk to the administrator?
So I assume you're talking about like folks that are 65 and older,
Correct.
So I mean, there's 2 pieces to that to kind of make it effective, if you will, and cost effective and time effective. You'd need to be able to book a certain number of appointments all of the same day, so that because you wouldn't want to run a school bus unless you had it full, whatever full meant as far as social distancing.
Half full, yes, half full. I understand.
And so then you need to make sure you get the appointments close enough in time so that bus isn't staying down there all day, because school buses aren't the most comfortable.
No.
It's not like you can take a coach down there and people can sit in the bus with it on and watch TV. If your appointments span 5 hours, that means a lot of people are sitting in the bus potentially waiting for the others to finish up. So there's some logistics to that. Could it be done? Possibly. Can it be done comfortably? That may be difficult.
Well, we have to try some way because we have to help these elderly people 75 over first, and then they go to 65, and then later on they go from the 18 on, and then they go further down. As more vaccine I get, the more people can get vaccine, so they don't have to worry about it.
So what I'm hoping is that all of a sudden it's just going to be this explosion of vaccine because they've ramped up production enough. Now I know that sounds like pie in the sky, probably to Mike too, because he probably has a sense of this. But that if the vaccine supply kind of explodes all of a sudden, maybe the state will reconsider their approach, and then maybe we'll get back the ability to do things more locally.
That'd be nice if it can be done.
Yep.
Thank you so much for what you're doing, Jimmy. Thank you.
You're welcome.
Jim, the clinics that you have, are they all, everything accounted for?
So at this point here, what we do is each week, and I've given the COAs their kind of their numbers for this last clinic that we can do. So I'm going to say, without checking with all of them, that they probably have people to fill all those appointments I've given them.
All right. Great. Any more questions for Jim? No. All right. Thanks, Jim.
You do the best you can.
I think so.
Thank you, Jim. Thank you.
Yep.
You're muted, Lisa.
I know.
She talks to herself. She needs time for herself. So she says, "This bunch of guys here, they drive me crazy." Right, Jimmy?
Yeah, absolutely.
We still love her. You can talk to yourself. That's okay. I talk to my birds. I have birds that come in the window there. Every morning I talk to them. I told them, it says, "Hey, where's my rent? I mean, I give you food. Where's my rent?" And they said, they turned their back. And that was it. That's it. You got to talk to somebody, honey. Don't worry about it. If you're for yourself or your dog or for your brother, your sister, your son.
Hey, Gino, hate to interrupt you, but Katrina's waiting. She has some real interesting news.
I'm so sorry, sir. I'm so sorry.
She waiting?
I'm getting better, and I talk a little bit, and I get it reprimanded. That's okay. No problem. I still love you.
All right. Thanks, Katrina. I wasn't sure if you were there, but I thought that I gave you a really good estimate between 7:15 and 7:30.
You nailed it. I'm Jim. I have to say that I'm totally impressed with everything you have to juggle, and I wish it could keep going. But thank you. And unfortunately, your information matches what I've found. So unfortunate. All right. So here's this week's snapshot or trends. So here are the four main things. And as you can see, we're looking much better than we were a month ago.
Beautiful.
Right across the board. So statewide cases and test positivity have returned to the same level that we saw about mid-November. The number of hospitalizations and deaths have declined, and they're more in line with what we saw just after Thanksgiving. So when things had started to like really rapidly rise, but everything looks much better. Although still high, so we're still got work to do, but not where we were over the holidays. So this is the number of tests. We've been really stable with the number of tests over the last month. I do see a little bit of a dip if you consider the last couple of days of information. Over the holiday weekend, as usual, there's a reporting delay and testing delays. So we'll have to see what happens over this full week of school break and if that impacts the testing levels like it did over Christmas. So we'll see what happens there. But the test positivity is on the right, and we are back down to where we were for test positivity right around the beginning to mid-November. So 2.3%, which is great. So cases are also trending down, just like test positivity. The number per day, I think, is on a different slide. We have like 1,800 a day now, which isn't low, but we're trending down, much better than we were. The 14-day incidence rate, daily incidence rate was 30 per 100,000 as of today. It was 48 when I presented last week, so it's come down significantly even in a week. And then we have got the hospitalizations, and the 7-day average is trending lower again. It's about 1,200 a day. So that's again about in line where we were just that first week of December, right after the Thanksgiving surge. Hospital and ICU capacity have both improved. It's 83% of hospital beds are occupied and 76% of ICU beds are occupied. I mean, those are occupied, so there's a little more room in there, but they're still pretty full. If cases continue to trend down, we would expect that these things will continue to improve. And the number of deaths have again declined, but they're still higher than they were at an average of 50 per day. So I think it was around Thanksgiving, they were closer to 25. So it's like a double still from where we were around Thanksgiving. So keep in mind what both of these are the lagging indicators. So as cases go down, these will continue to trend down. And even if cases kind of tick up, you might have these trend down for a little bit more before that starts picking up again. So all in all, the 4 main metrics that are state measures, we are trending all downward in a good direction. And let's just hope it keeps going that way. So then we're going to look at Littleton. This is the information from last Thursday's weekly report where the DPH comes out by town. So for the period of January 21st to February 6th, we had 44 cases. So this was last week's. And so that was just slight. So this is the 44. It was slightly higher than the 2 weeks prior, which was 37. The rest of the state kind of trended down, and we had this little like leveling / slightly higher over 2 weeks. So that was different for us, but you can see it when you look at the rates here. This is the rates per 100,000 average daily incidence rates. So the same time period, you can see that Littleton kind of flattened and slightly higher, where everyone else kind of kept going down, except for our border towns also flattened. So Littleton's rate last week was 32.2 per 100,000, which was, similar or slightly higher. And we'll see where we are tomorrow when the data gets released. This is the test positivity. So this is the total number of positive tests over the total number of tests conducted for Littleton residents. Then we had nearly 1,400 tests, which is a stable number of tests. We've had that number for multiple weeks in a row now. So our test levels have been stable, and our test positivity last week was 3.24%. And like cases, that was also like a leveling / a little bit higher than the 2 weeks prior. So again, we kind of like tilted up where everyone else had kind of gone down. So we'll see where we are tomorrow. So Jim very kindly gives the sneak peek into the Maven system just to give us an idea of what tomorrow will bring. And this was actually very hopeful. So Jim's sneak peek said there was 29 cases in the last 2 weeks, which is the period of January 31st to February 13th. So 29 cases being lower than the 39 from 2 weeks ago, and almost gets us back to the yellow. Almost, we're like 4 cases off, 5 cases off to get under again. So that actually, last week I was saying we're still at the levels that we were before Christmas, but this week's number puts us back to where we were before Thanksgiving, the 2 weeks period before Thanksgiving. So it took us longer to get down there. Hopefully we stay down there. With vacation, I'm a little worried that is not going to hold between the holiday weekend and vacation. But remember, there's usually a data lag with any holiday. And so I don't actually expect to have a good feel for this for another 2 weeks. So maybe the next time I talk to you guys, we'll have some data that I can talk about.
Good news.
But however, I like this trend. Let's hope this keeps going. But again, we're 13 weeks in the red. So at this point. All right. So then just some global things to keep in mind. The variants are still very much a concern. The UK variant has gone from like 24 states, being present in 24 states to 42, including Massachusetts. And there's a number of cases in Massachusetts. It's no longer just 1. There's like 30, I think it was. And then unfortunately today I heard the South African variant has arrived in Massachusetts. So it's now present in 10 states and including our own state. And both of these, actually all three variants that are listed here seem to be more transmissible. And the South African one and the Brazilian one there are concerns about, the South African one, there's concerns about it might lower the effectiveness of the vaccine. But it seems like because Moderna and Pfizer vaccines have really high efficacy, there's a cushion there. So it's still important that everyone gets vaccinated because as these variants spread around our communities, those vaccines will still have effect in helping to reduce disease. So it's really important everyone keeps doing everything we've been doing. It doesn't change the need for a good quality and well-fitting mask and physical distancing, avoiding crowds, limiting your time when in crowded situations, and washing hands and all that stuff. So they're here and we need to be better at what we do to prevent spread. So just like the layers, which I just listed, those layers of cheese are really important. I do appreciate now that I hear people talking about layers of cheese. So if anything, my tagline can be Swiss cheese from now on. So Jim covered this beautifully. The governor announced today that 65 and older and people with 2 or more specified comorbidities, as well as some low income and affordable senior housing residents can access vaccines starting tomorrow. The governor did say that the appointments would be dropped sometime in the normal range of when they should be dropped. So he said something like 8 a.m., but I don't know when they'll drop. So I'm sure there'll be a rush for appointments, but he was very clear that without more supply from the feds coming in, that he'll just keep adding appointments. They will keep adding appointments as they have supply to cover those appointments. So you'll just have to keep going in and trying to find an appointment over and over, unfortunately at this point. But hopefully, as Jim pointed out, if there's just suddenly a lot of supply, hopefully we can just increase the access points for that. These are the medical conditions. So individuals 16 and older with 2 or more comorbidities on this list are eligible to get vaccinated starting tomorrow. So that's cancer, kidney disease, chronic kidney disease, COPD, Down syndrome, heart conditions specified here, some immunocompromised states. That doesn't include, I don't believe that includes things like if you're on chemo for cancer and you're immunocompromised because of that, that actually falls under cancer. So if you go to the website, you can click on each of these and it will tell you specifically what would qualify you. Interestingly, pregnancy is on there. So if you're pregnant and you have another comorbidity, then that's
65.
yeah, or you're, yeah. Well, no, this is separate. It can be 16 or older for this and then 65.
Okay.
Yeah. So there's sickle cell anemia. I'm not entirely sure. I didn't click on this, but I see smoking on this list. So it'll be interesting to see how they do that. Type 2 diabetes and asthma. And asthma is different than a lot of other states. This is moderate to severe asthma. Massachusetts has added this. So if you have any of these conditions, 2 or more of these conditions, I'd be interested, go to the website and just click to see if you're eligible or not. So it's my understanding that it's an attestation form to say that I do qualify to be in this phase and that most people are being honest. So hopefully everyone is lining up when it's their turn. Oh, and I missed obesity. So there's an obesity one in there. So just, these are the new guidelines coming out tomorrow. And I do hear, I know Mike had experience with Gillette being a good, well-run site. I've heard great things about Gillette and Fenway, and I heard that Lowell might come online soon. So hopefully that would be closer to us. That'd be great. All right. And then as we're talking cheese and these variants, and just masks are one of the most simple ways of and accessible and inexpensive things we can do to protect ourselves. So if you're matching your mask to your environment, if you're indoors, if you're near people you can't keep physically distant from, if you're going to be in a crowded setting for a long period of time, that's when double masking or adding a filter or wearing a surgical mask those kind of things would be really beneficial. You're really looking to improve the fit of your mask so you're not breathing around your mask through any holes. So you want a snug fit on your nose, chin, and make sure there's no wings on the side of your face. And then adding layers to improve filtration to capture the virus particles before they reach you or before they leave your mask area. So those are just two really simple, like improving your quality and fit of your mask is just one of the most simple ways that we can help protect one another and really hopefully drive down the spread of COVID in our area. So, and I've actually, it's been really nice to see. I saw a social media post on the EHS website yesterday, and there were a couple of people double masking. I've seen some of the principals double masking and in the pooled testing pictures the school put out. So things like that, that was really, like, some people are doing it and modeling it, and it's awesome to see. It kind of makes me feel good. So that's it for this week. In terms of the schools, as a parent, I didn't receive any notification. I know that at last week's meeting, cohort A, which my kids were in, there were no cases, and they say no news is good news. So I'm assuming cohort B, the second half of the week, was also no cases, which would be great. And the CDC did drop new guidances, and they do emphasize masks 6 feet to the extent possible. And they've really emphasized tying that to community metrics like incidence of disease in the area. So what I haven't done yet is to look at and they changed it to a 7-day rate. So we have to do some more math to figure out where we sit. But I'm pretty sure that I've got to sort it out. I've got to figure out where our community metrics are before the next school committee meeting so that they have that information for decision-making on the school part. But there's a lot to still work out. But everything, I have to say, if you go to the CDC's website, the amount of information on the website, the details have really, there's a lot of new details and a lot of information has been added. So, and I know I emailed you guys the guidances last Friday when I sent out the metrics to you guys. So the information, hopefully you guys have, and we'll just keep working through.
Great, thanks, Katrina. Anybody, Kevin, Gino, or Mike, have questions for Katrina or Jim?
I'd just like to ask the young lady, I understand we had 44 people getting sick. The question is, anybody died? No, in Littleton?
I don't know that. I don't report it by town.
Oh, yeah, okay. But anyway,
that is unknown to me.
It seemed like the count is going down a little bit.
The number of cases are going down, and the test positivity has gone down. Both of those are really great things to see.
Thank you so much for what you're doing, Annie. Thank you.
You're welcome.
Kevin or Mike, any questions or comments for Katrina?
The good news.
We're that close. Yeah.
Just want yellow. Let's go back to it.
What
my
exactly?
favorite color. I don't like red.
Oh, I thought we were that close to a reasonable supply of vaccine.
That's going to take a little longer. It would be nice to have a reasonable supply of vaccine. Someday. Soon.
Well, all I can tell you is one of the manufacturing sites was pretty close to operating 24/7, and at night they had these big lights that have to be shielded in the manufacturing area, and they lost power, and the whole production was lost. So there were probably a couple thousand doses in there, potential doses. Now this is not a disaster. Please, this is normal manufacturing risk.
Yep.
And the only reason is that the timer for starting up the emergency power, in case Ed was asking why they didn't turn on the emergency power instantly, they did, except that someone forgot to
switch,
not to open up an exhaust valve. So the result is that the dose components were compromised. They had to start from scratch. It wasn't a total loss.
Was
Wasn't
this down in
told.
Texas at all, Mike, with all the,
I can't comment. I'm not trying to be difficult or important. I'm just trying to tell you that
mhm.
they're not going to share with me all these adventures from far-flung parts of our country.
Just with the ice storm that they had down there, people are still out of power.
Yep.
Yeah.
Texas, California.
So there's a take-home message because, you know, our power systems are winterized, and the ones in the southeast, and as you go, obviously, to warmer weather, they're not.
Only works in the summer.
All right, great. Good news, Katrina. Thank you.
Let's hope February break doesn't blow it.
I know. Do you know, you've got kids, and Kevin, is there another attestation, for the kids? No.
No attestation form and no week of remote following
Yeah.
school break. So they do have testing now. So hopefully that helps.
Yeah.
But with all the snow days and everything, it was so disrupted that I think with testing,
First week of testing, yeah.
it'll be interesting to see what, if anything, is found in that first week back.
Yeah, it's too soon.
It's too soon for cohort A. Well, not necessarily, because it's a whole week break. So it could be that you'll catch in both cohort A and B.
Oh,
All right, great. All right, thank you.
thank you.
Ed, is there anybody in the audience with their hands up at all?
Yes, we have a question from John.
Okay, go ahead, John, state your name and address. Thanks, Dave.
It's John Kurzwick, 171 Hartwell. There was a question about have there been any recent deaths for COVID? I don't have the month of January or February, but last recorded death that I received from the town clerk was December 29th. There was a death at the Life Care Center on the 22nd. And then there were 2 residents that passed away from COVID. So still occurring, but majority of deaths are still at the Life Care Center. And it's my recommendation that the board keep track of these deaths so that we can continue to monitor how things are going.
Okay, great. Jim, is Mass Department MD, are they still watching that, the state?
I know in the springtime when there was a bigger issue there, they were having meetings. I think those meetings were 7 days a week at one point because we were involved with them, with the State Licensing Bureau and other entities within DPH. About May, those kind of fell off based on the fact that they were in a better situation. We have seen cases popping up in some of the long-term care facilities, but not lots and lots of cases like in the beginning, because I think they're doing some testing in-house also to kind of keep an eye on that and catch it.
Great. All right. Anybody have anything to add or discuss before we talk about our next meeting?
When is going to be next meeting?
So I'll give you a call. We have our next scheduled meeting will be March 3rd. And then we have I'll talk to you later, Gino. We have a Board of Health retreat in person next Wednesday at 7 o'clock on the 24th at the multipurpose room. So, but Katrina and Jim, you got next Wednesday off.
Great.
From us, anyway. So,
You're gonna email me, right, Annie?
yes, I'll call you, Gino.
Thank you.
All right. So, have a motion to adjourn?
I make a motion to adjourn. Thank you so much. It's nice to see you guys.
Good to see you.
Anybody want to second that? Kevin?
I'll second it.
Good. So do the roll call. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Gina Ferroni, yes. Thank you, Kevin.
Mike Selden,
Mark Selden, yes.
and Lisa Flanagan, yes. All right. Thanks, guys.
All right, good night.
Thanks, everybody.
Good night.
Good night.
Talk to you later.